Hello, KATZ Chiropractic and Rehabilitation Clinic. I want to go over a little bit about how we, at our office, Dr. Evan Katz and my wife, Dr. Shauna Katz, how we look at, address, and treat upper cervical instability. Upper cervical instability has been, I think, a hot topic in the last year or two. In our office, we've been treating this for about 20 years. We published one of the largest papers on identifying upper cervical instability and instability in the cervical spine, as well as we're one of the first ones to really publish non-surgical management of managing this very complex injury. Now, I just want to walk you through a little bit about what we do. This isn't fully in detail because we get a lot of these questions. One, we get asked a lot, do you do just an upper cervical technique like AO or some other upper cervical technique if you have instability? And we don't do that. Do we think it's effective? For sure. But we don't do that, and here's why. This is what we have seen in our practice. Not saying that we're better than anyone else or we get better results, but this is how we've been doing it for 22 years and what we've seen. One, when you have upper cervical instability, it's not just C1 that's a problem. We believe that there's more than one bone in the body that can affect an area, and we don't think that just one part or one bone affects everything else all of the time. So we do a full body approach. We also understand that the shape of your neck, and we publish this, affects the upper cervical spine. Right? You're supposed to have a lordosis, so 2/3 of the weight should be on the back of the spine. Most of these patients that we see have upper cervical instability also have a buckling of the neck. Now, if you buckle the neck and now the patient still needs to see straight ahead, what happens? You're loading these ligaments, and you're constantly loading these ligaments. So until we address the curvature, we're constantly going to keep loading these upper cervical ligaments. So we need to address the whole thing, right? These ligaments may be permanently disrupted. They may be permanently weaker. We believe we can get them stronger, but we also have to get the full structure stronger. The other thing is, here's a video we did with us trying to just get on C1, right? So in this video, you could see the pisiform, or the part of my wrist, and how close we can get it to C1. We can't get it as close as we would like. The other thing that we've seen is that if C1 is fully unstable, do we want to continue to adjust it and put a force in it? Sometimes yes, sometimes no. But we also need to look at the full mechanical loading. We do know that the abnormal mechanical loading can affect the upper cervical spine, and we know that when we're trying to stabilize the upper cervical spine, we also want to start to stabilize below it, so that that area is functioning, right? It's just like saying, hey, my low back is unstable, but I take off my one shoe, and now I'm more unstable. But now I keep adjusting my pelvis, and I keep adjusting the pelvis, but every time I get adjusted after laying down, I go and I walk around one shoe on and one shoe off. And what's going to happen? It's going to continue to have an abnormal loading. So how do I fix the instability that constantly keeps showing up in my SI joints? Let's make the whole structure stable. How do we do that? Well, if I'm only wearing one shoe, let's put the other shoe on or take that one shoe off. So now I'm stable. That same thing we found to be true in our office. If you have this abnormal curve with upper cervical instability, which 99% of the time we've seen that, you're having an unstable structure with an unstable segment on top of it. So if you have this unstable structure and we just stabilize the unstable segment, that stable segment might stabilize, but the structure is fully unstable. So what happens if we start to work and structure or stabilize the full structure? The one segment may become more stable. And that is what we found in our paper. So Do we get everyone better? Of course not. And anyone who tells you that they get everybody better and they can always fix this, they're lying, right? The human body is incredibly complex. I wish I had a magic wand that I could wave over every patient suffering with upper cervical instability. So does Dr. Shauna, because we know how complicated this injury is and how much it affects you. Do we have all the answers? Of course not. That's why we do research. That's why we look. That's why we analyze. That's why we use our digital motion x-ray machine to try to gather as much information. A patient with EDS compared to a patient without EDS, guess which one is probably going to be a little bit easier to manage? The one without EDS, because the structures can have a better time healing than someone who has EDS and is also suffering with upper cervical instability. So in our office, that is what we do. We adjust usually below the unstable segment. It's unstable. I don't want to add more movement to it all of the time. I want to improve the overall structure, which we're going to look at the whole spine. We're going to look at not just C1 being unstable, but are there other segments that are moving too much or too little, as well as an abnormal curvature, and how we can fix that. We're going to do different types of traction, but we're not going to do a traction that's going to stress the upper cervical ligaments. We're going to take that into account, and we're going to see how your neck moves in the mid-range. That's why we use full motion, digital motion x-ray, so we can see how it moves mid-range. We can see when that area starts to become a problem when we don't do any traction beyond that may cause a problem. Then we do different stabilization exercises to try to stabilize everything else around it. That is what we've done in our office. That is when we've had really good success with a large percentage of our patients. This is something we just want to put out there to explain to you what we've done in our office for over 22 years. We know that upper cervical instability is a hot topic, and we've seen tons of providers advertising that they have experience in treatment with this, and I don't know if they do or don't, and it's not necessarily for me to say, but this is what we have been doing for 20 years. This is the amount of patients that we have seen and the publications that we have published, so we can help push the profession forward and help these patients that really have nowhere else to turn to, because some docs don't want to treat these because it's complicated, or some docs are saying they do treat it just to try to get new patients, and they're not doing full motion analysis, and they don't have full experience with treating this. So we just want to explain what it is that we do at KATZ Chiropractic and Rehabilitation Clinic. You could certainly contact us with any questions that you have, and we'd be happy to help. We'd be happy to do webinars for patients all over the world, which we do. Let us know if there's anything else that we could do. I know we're just kind of touching on it, but I just wanted to explain why we do what we do in our office with the success that we've had. And we know how frustrating this injury is for you as a patient, and we want to help be a resource for you in any way that we can. Please contact us, have patience with us if we don't get back to you right away. We do the best we can with having patients here, and also staffing in our office. It's just my wife and I, usually with one front desk person. We do the best we can with the amount of time and space and energy we have, but please, anything we could do to help, you let us know. Thanks so much. Again, KATZ Chiropractic and Rehabilitation Clinic in Boulder, Colorado.